Today is the day that qualifying Arkansans can start getting their COVID-19 booster shot. Hospitals and pharmacies are now giving out the extra dose of the Pfizer vaccine after the CDC gave the booster the green light last week. Again, this is only for people who got the Pfizer shot. UAMS is holding a clinic this week at its parking lot on Monroe Street. It's open until 4 o'clock this afternoon until Friday. We'll have much more on the latest wave of vaccinations tonight at 5 and 6. There are still people with plenty of questions about who's actually eligible to get the extra shot. But don't worry, Evan Kosloff with our Verified team has everything you need to know before scheduling your third dose appointment.
A major announcement from the CDC. Booster shots are now approved for millions of Americans. So let's verify some of the details so that we can be sure that we're sticking to the facts. Here are our sources: the CDC, the FDA, William Schaffner from Vanderbilt University, and Amesh Adalja from Johns Hopkins. Let's start by talking about who's eligible. We can verify that according to the CDC, those over 65 should now get a third dose of the Pfizer shot, so long as it's been 6 months since they first got vaccinated. Same goes for those receiving long-term care and those 50 to 64 who have an underlying condition such as diabetes, obesity, or heart disease. As for those 18 to 49, the CDC says that they may now get the booster if they have an underlying condition, but they're recommended to talk to their doctor first.
This is more commonly referred to in medical language as shared decision making, where you speak to your physician and say, should I get this booster? Should I not get this booster?
Next, let's verify if you could get a booster if you work or live in a place where the risk for COVID is high, a so-called occupational or institutional environment. For example, healthcare workers or teachers. Initially, the answer was no. The CDC's advisory committee voted against recommending boosters for these people, but that was reversed by CDC Director Rochelle Walensky.
Anyone who works in an occupational or is housed in an institutional setting where there's the potential for high transmission, they also would be eligible for a booster.
So verified, yes, you could get a booster after 6 months if you work in one of those environments. Lastly, let's verify. What does this mean for those of us who got Moderna or Johnson & Johnson? Are you recommended to get a booster shot at this point? Our experts say that the answer is no. That's because no Moderna or J&J boosters have been approved, and it's not recommended to mix and match.
The official recommendation is not yet. Please be patient.
With your Verify, I'm Evan Kosloff.
All right, let's take a look at our COVID-19 numbers from this weekend. Hey, we have some positive news to share with you here. The state reported just under 1,500 cases for both Saturday and Sunday combined. And get this, that's a nearly 40% drop from the weekend before. We also saw our lowest active case number in Arkansas in almost 2 months. And COVID hospitalizations are dropping as well. As of yesterday, there were 861 Arkansans fighting the virus from the hospital. That is down 95 since Friday morning. We have talked so much about COVID-19 over the past year and a half or so, and the vaccine for that virus. State health officials say we cannot forget about the other big virus this time of the year. Of course, that is the flu. Today, the Arkansas Department of Health is hosting its first pop-up flu vaccine clinics of the year. So take a look at your screen right now. You'll see the time and locations for today's clinics in our region. They're in Hot Spring and Deshay counties. The clinics continue across the state for the next few weeks. If you can't make it to one of the big clinics, there's good news for you. Walk-in flu shots are available at local health units across Arkansas. There's no out-of-pocket expense, but you are encouraged to bring insurance information if you have it. You can also just get a flu shot at your doctor's office or most local pharmacies. We have a list of the pop-up clinics and the local health units for you. Just look for this story on the homepage of thv-at-noon.com. Friends and family gathered this weekend in New York to remember Gabby Petito. She's the young woman who was found dead a week ago after disappearing during a cross-country road trip with her fiancé. He is now the focus of a nationwide manhunt. Naomi Ruckham has the latest on the search this afternoon.
The FBI continued its search for Brian Laundrie Monday in Florida, a day after going to his parents' home to collect personal items to help with DNA matching. Laundrie and his fiancée Gabby Petito were on a cross-country trip when she went missing and Laundrie returned home alone. Her body was found last week. The cause of death has not been disclosed, but authorities say it was a homicide.
She genuinely loved people.
At a memorial service in New York over the weekend, Petito's father said he wants people to be inspired by how his daughter treated others, and he offered advice to those listening.
There's a relationship that you're in that might not be the best thing for you. Leave it now.
The case has renewed a conversation about which missing person cases get media attention.
We can name the Natalie Holloway, the Kaylee Anthony, the Lacey Peterson, the Chandra Levy, but no one can name one black or brown missing person of color in the United States. Not one.
The Black and Missing Foundation says nearly 40% of cases involve people of color, but they rarely make headlines.
We need law enforcement. We need them to be held accountable and making sure that they're taking these police reports. We need the media to share these cases, and we need the community to come forward.
There were more than 145,000 missing persons of color under the age of 18 last year, according to the foundation. Naomi Ruckham, CBS News.
The Black and Missing Foundation says one of the major reasons for the disparity in media coverage is that oftentimes missing minority children are initially classified as runaways and missing minority adults are labeled as being involved in criminal activity. A busy Monday afternoon here. In other news, all eyes are on Capitol Hill this week as a government shutdown looms over lawmakers. The Senate is scheduled to hold a procedural vote today on legislation to fund the government through December 3rd and raise the debt limit. But Republicans say they will block any bill that links the two. The White House has officially put federal agencies on notice to get ready for a possible shutdown, warning it is, quote, preparing for any contingency. And that comes as the House begins debating President Biden's nearly $1 trillion infrastructure package. Lawmakers were supposed to vote on the bill this afternoon, but House Speaker Nancy Pelosi pushed it until Thursday to rally more support for the bill. Meanwhile, the head of the Congressional Progressive Caucus says she has at least 60 votes to block the measure. They're now demanding the House and Senate first pass a $3.5 trillion spending bill that includes new funding for the child tax credit, universal pre-K, home health care, and much more.
If somebody wants less than $3.5 trillion, tell us what you want to cut. Do you want to cut the child care? Do you want to cut paid leave? What is it you want to cut? And then let's figure it out from there.
Two moderate House Democrats have already said they would support the spending bill to get infrastructure passed, but Republicans are unanimous in their opposition to more spending. Back here at home this afternoon, Arkansas legislators will meet later today to discuss the redistricting proposals one last time. Here on your screen is a map of Arkansas's current congressional districts. Every 10 years, when the census happens, legislators discuss if they should be split differently based on that latest census data. 7 different maps have been made public so far. 2 have been from a Republican senator and a Democratic representative. Senator Bart Hester says he tried to keep as many counties whole as possible until you get to Pulaski County, which he proposes be split into 3. The Democrats' proposal, created by Representative Reginald Murdoch, has no splits. But you might be asking yourself, how does this impact me?
You know, it's one vote, one person, and that person should be represented, their ideals, their thoughts, their community. And it's very important that that happens at the highest level.
No matter what map is put forward, people are going to argue and say they got problems with it this way or that way. But I go back to this point. There is almost no map that can be drawn that we're not going to have 4.
And he said that there's no map that can be drawn where we would not have 4 Republican congressmen. Again, legislators will meet for a third and final time this afternoon at 1 o'clock. After that, we have a much clearer picture on how this all shakes out. Of course, we will have the latest for you right here on THV11 and thv-11.com. New at noon here, Jeff Dunham is bringing his ventriloquist act back to Arkansas next year. After taking a year off during the height of the pandemic, the comedian says he and his puppet friends are hitting the road again and making a stop over in North Little Rock. You can catch the show at Simmons Bank Arena Sunday, January 30th. Tickets go on sale next Monday at 10 o'clock a.m. They'll cost you about $52.